Well, we are officially live. If I can begin by just saying a warm, warm welcome to everyone that is tuning in to the S-Connect Women Breast Cancer Awareness webinar. Thank you so much for tuning in, taking time out of your Friday to be with us. I really hope you find this session informative, and really, I hope you can take something away from it. And as we finish off October, which is Breast Cancer Awareness Month, let us not forget the fighters. Let's continue to support them, admire the survivors, and of course, honor the taken and never giving up on hope. Welcome, I'm Zoe Brown. I'll be your moderator for today. And what's quite nice is I get to see the panel, which is quite nice and interactive. Ladies, hello.
Hi.
Here we go. So start off by hearing from Ariella Cooper, who is a two-time breast cancer survivor. Luzelle Jon Lestrada, and I really, really hope I pronounced her surname correctly there. Also a breast cancer survivor, currently based in Namibia. And then we have on our panel, Dr. Wendy Dean Colomb, based in the United States. So it's morning for you right now, yes?
Yes, good morning.
Morning, Dr. Wendy Dean. She is a medical oncologist and internal medicine and medical oncology board certified practitioner. And then we also will be hearing from Cara Noble from Cancer. Well, ladies, I think we should start and just jump straight into it. I'm going to ask Ariella first. I met you briefly last week on the Espresso Morning Show when we were promoting today's webinar and Sunday's high tea. And it's so good to see you again.
Super to see you too. Thank you, Zoe. You look gorgeous as always.
Thank you. So do all of you. Now, Ariella, I remember you shared a very, very interesting snippet of your story, and I know there's so much more to it. Do you mind starting off with where you were diagnosed and when you found out?
With pleasure. It was actually the last day of our holiday in Mauritius in January 2016. And actually, I just bought a new bikini lying on the beach before we were going off to the airport. And my husband reached over to admire my costume. And he literally, I know it sounds bizarre, but he actually found a pebble-like stone on the side of my breast. And the one thing I can tell you is if you ever want to know what it feels like, bend your knee in half. And that is the sensation of a pebble-like stone, because a lot of people often query about it. And that was the first time that we found it. And then it came back a second time, 2.5 years later, which I'll get into. But that was when I went for an ultrasound. They thought they had picked up scar tissue and said to me, leave it 6 months. We're sure it's just scar tissue. I was completely neurotic and nervous for understandable reasons of the previous 2.5 years. Went straight for biopsy 4 days later. And what they had found was indeed scar tissue. What they had actually missed was another tumor. So yeah, my first tumor was pretty much the size of just short of a tennis ball.
Sure, that is quite scary that it was missed. Now, in terms of when you were diagnosed, which stage were you at?
So that was another interesting thing. When they got my histology report back, there was a report that one said stage 3, and turns out there was another report given to another doctor that said stage 2. And there'd been a typing error by the pathology lab on the histology report, and they'd forgotten to destroy the incorrect one.
You know, this is bad news to receive, and then to have that happen on top of everything, I can't even begin to imagine how you were feeling. What went through your mind throughout that initial process? Because you just had mishap after mishap take place.
You know, that's an interesting question, Zoe. And to answer that really briefly, that when I got first diagnosed, when my husband found it, very briefly, it took me 5 days to actually go to the gynecologist. We had just flown back in from Mauritius. I went straight to Joburg for business. We live in Cape Town, and I didn't take it seriously. And he was the one who pushed it. But from the moment I met the gynae, and I'm just giving some context because I think it's equally important. From the gynae, literally the way she withheld information and just allowed me to percolate and process the information, and then said to me, go and see Jenny Edge, who's a top surgeon. I think that she'll make herself available. And I said, when will I be seeing her? And she said, oh, she's waiting for you. And that's when I actually found my husband to join me, and I drove there. And, Jenny basically did touch and feel and pulled me to a desk, and I remember standing there literally like this, and I went, Dr. Edge, I'm not the world's most emotional person. I sell mining equipment and oil tankers, so when are you going to do a biopsy to tell me that my tumor is benign? Now notice, I never said if it's malignant. I just assumed it's benign. And she said to me, I'll never forget, she lowers her glasses, these pink little cute things, and she goes, Sugar, when you stop talking, I will be conducting a biopsy because that will just confirm. So Discovery can authorize your surgery because you have aggressive malignant breast cancer. And so if you ask me how I feel, I've literally moved my foot onto my husband's to earth me because this doesn't happen to Ariella Cooper. It's amazing how arrogant we are as humans. That's what saves us, but that also is our biggest stumbling block. And I'm being brutally honest. It was like, there's no. So that was my first time. The second time, I'm not going to focus on too much because by then, you're sitting on a couch. My husband was on a plane, couldn't get hold of him. And I was like, this has come back. So I think the bigger learning curve I'm going to focus on in today's story was the journey of the first time. So I'm going to let you ask a few more questions before I answer everything in advance. But I think that's where my learning took place in those first 2 years.
Sure. Absolutely incredible that you are sharing your story. I know this is a question, and I sometimes wonder if it is relevant, but has there been a history of breast cancer in your family?
Nothing. Zoe, there is no cancer. I've done the BRCA test. I sent it to America. I did all 11 or 14 screenings. Nothing. Stress. Stress. Everyone underestimates lifestyle and stress. I will emphasize lifestyle and stress.
And it also counts against us that we are women and we are aging. That also counts against us. And then in terms of Ariella, when it came to staying positive, I mean, you've got such a wonderful outlook on life. The way you've just retold those stories, you do it in a very positive way. What was your go-to way to try and stay positive throughout this entire journey?
I think out of all your questions is probably the most important one. And to respond to that, I couldn't sleep because you can't. That's me in action last year, guys. Raising money for charity. That was for Francois Pinner's auction, raising money for students so that we can give scholarships, living life, having fun. And by the way, guys, this is all in between treatment. So part of my answer that I'm going to give you, I was a couple of kilos thinner there. There's always an upside, never waste a good crisis. But you asked me about that. I started researching. I started using the time that I couldn't sleep to read and read and read and read. But I did not read blogs. Guys, don't read blogs. Anyone out there listening, if you actually look at blogs, you've got probably 38 people giving comments. That's 38 people out of like 55,000 people who have breast cancer a year. You've got to get perspective. If you're going to research information that has credibility and gravitas. Don't waste your time on someone who you have no concept of who they are and they're reporting the worst of the worst because they have time to type on their blog. The second thing is I walked every single day. Cancer hates oxygen. It is brilliant for your mind and it's brilliant for your body. You walk, you take time out and you start owning your space. You only have so much energy that you can give out. Reserve it for yourself. It's your time to be selfish. And the other part was I challenged everything and I sought out every functional doctor that I could because I think there's a hybrid. You have to have a holistic approach to what goes inside your body, but also to manage the side effects of the treatments you go through. Never forget, if your body's in an alkaline state, your side effects from the damage of treatment will be reduced. I did work, as you saw, just one last comment. I did carry on working, very limited hours, but I needed purpose.
Wonderful. Thank you for sharing. I want to ask one more question, if you don't mind.
Sure.
When it came to your support system, what was it that you did receive in terms of support? And was there something else you wished you had received when you were diagnosed?
My surgeon encouraged me. 7 specialists who looked at my histology report all came back and just said to me, chemo. It was a stock standard response. You've got cancer, it's aggressive. They reckon if they'd left it a few more weeks, it would have metastasized. And Jenny turned around to me and she said, Ariella, send your tumor to OncoDX in Cleveland in America, get genomic testing done. This is what the world has to offer and own it. And so when you ask about support, she remains today one of my most precious human beings on the planet, besides the fact that she's exceptional in her capabilities. It was her practicality. She said to me, go and see a psychiatrist if you're not dealing with it. You can't, her words were, you cannot just exist, you also need to live. So between family, close circle friends, don't feel the need to tell everyone your story. They just want to hear it. You only can give so much energy. So keep your circle small and valuable, where people also build you up. Don't allow people to embellish the fact you're a victim. You're not. You're not. It happened to you. Use cancer as a canvas to paint a new narrative. You've got to look at that there's a message being given to you, and value the people around you, but get professional support as well. You can't do everything on your own, and it doesn't mean you're a failure. It means you're sensible.
Ariella, thank you so much for those wise words. I'm like, we're all nodding along, and I'm pretty sure those at home watching right now also agreeing with you right now. Thank you for sharing your story. You will be at the high tea on Sunday, correct?
That's correct, yeah.
Okay, well, we will see you there. Thank you so much. We now have Luzelle, another breast cancer survivor, currently in Namibia. How's the weather there for you guys?
Quite cold, a bit chilly. We've had rain, which is awesome.
Yeah.
This time of the year, it's quite strange that we have rain at this time of the year, but yeah, we really need it. So yeah, so the weather is really awesome today.
Oh, I'm glad to hear that. Well, Luzelle, let's jump into it. You have a very unique story, and I know this is what's so interesting is everyone's journey is different. Do you mind shedding some light with when you were diagnosed, how old you were?
Okay, I was 33, Zoe, when I was diagnosed. I lived in South Africa at the time. I was in Pretoria, and on the 9th of February 2018, and I had my two boys at the time. My older boy was 3 years old at the time of my diagnosis, and the little one was 1.5 years. So yeah, so we lived in South Africa at that time.
Oh, and your boys were so young when this happened.
Yes.
How did you discover that you have breast cancer?
Yeah, before I continue, Zoe, I just want to say thank you so much, Ariella. I've learned so much. I'm a breast cancer survivor, and I've been sitting here taking notes. So thank you so much. Yeah, how did I discover in 2017? Pretty much the same as Ariella's story to a certain degree. I was also misdiagnosed for over a year. So I discovered a lump similar to what she discovered. It was like a pebble. It kind of moved in my breast in 2017. And I was quite healthy, fit, was on my goal weight and everything. So I didn't have any other health problems. And so when I went to the hospital in Pretoria, they said, this looks like fibroids, so come back in 6 months. And I went back in 6 months, and then the fibroids grew, and they said, okay, fine, let's come back again in 3 months. And so after 3 months, I went to a different hospital because I wanted a second opinion. I should have actually have done it earlier, but in any case, I went to a different hospital because I knew that something was wrong in my body, and they just thought it was fibroids because they said, you're pretty healthy, otherwise there's no reason for us to actually stress about it. And so when I went to the second hospital, also in Pretoria, they also really didn't expect this, but they said, just for us to be safe, let's do a biopsy. And when the biopsy came, they were quite shocked because they didn't expect it, and neither did I. Yeah.
Okay, sure. Well, I'm glad they were able to diagnose it. And you know what? I think that is the scary thing, is the misinformation as well as the misdiagnosis. I also wanted to know, how did you feel during that process? What was going through your mind?
At the time of diagnosis, yes, or during my treatment? Okay.
Let's start with diagnosis and then move through to treatment.
Okay. When I was diagnosed, I either do two things when I'm very nervous, or when I get bad news, I go silent completely, or I laugh a lot. And so I just went silent. I just didn't really know what to say. The doctor kept on talking, and I just get quiet. Luckily, my friend was there with me, so she took in some of the information. I just completely went very quiet. And when I went home, my mother was in Namibia at the time, and she said, you know what, my child, today we're going to cry all our tears, and tomorrow we're going to get up and fight. And that is what we did. And I stayed positive throughout the process. I worked for the United Nations in South Africa at that time, and they were very supportive. But a lot of people struggled to oh, that was the shoot from last week. Struggled to believe that I was actually undergoing cancer treatment, because when I stepped out of the door, I tried to be as positive. I put on my game face, but I wasn't always positive. At home, I struggled. I had days when I broke down. I had days when I wanted to give out. But when I stepped out, I was positive and I was strong, and I took the bull by the horns.
And how did your boys process this? Because they were quite young when it happened.
Yeah, but I think children know what's going on. Children pick up on vibes. They pick up on your fears. They pick up on, the emotional climate in the home and so forth. And so my children did struggle, I think, emotionally. But luckily, I had good support from my husband, who looked after them. My family, most of my family was in Namibia at the time, but they had a schedule. They came down for every chemo treatment and so forth, and so they were really there. At some point, I wanted to give up on the chemo, and my brother flew in from Namibia just to say, listen, let's just be practical about this. Let's just look at your options and see what is best for you. So I had good support on the days when I wasn't able to pull the wagon. There were a lot of other people, especially friends and family from church as well, who really kind of just put a circle around us, and they took us by the hand. So I was really, really grateful for that.
Oh, Luzelle, it sounds like you have an incredible group of people around you that makes your support system. And I really feel honored that you are sharing your story with us today. I wanted to know from you, what is the biggest misconception that people generally have about breast cancer patients?
Well, I think there are so many, Zoe. The first one is that the ageism when it comes to breast cancer. There's a lot of misconception about who can get breast cancer. And so I was young and seemingly healthy at the time, and so the misdiagnosis also came from that, from even the medical fraternity's misconceptions about breast cancer. So I think that is one. Also, the fact that quite a few men are also affected. And I'm 2 years post-treatment right now, almost 2 years post-treatment. And the thing that I'm dealing with now is that cancer doesn't end the day that the treatment ends. You kind of, it's a new lifestyle that you adapt. And for me, there's a lot of emotional healing and psychological healing and all of that goes with it after the physical healing has taken place. So those are a few of the ones that I've been just thinking about, yeah.
Do you mind expanding on how you've changed your lifestyle since the healing has taken place?
I gave up my job for the UN. I loved working for the UN, but it was a stressful job as well. Ariella mentioned the issues of lifestyle and stress. So for me, cancer is in the family. They say my BRCA test was positive, so the genetic tests showed that I was at a higher risk of developing cancer. But I think that it was an interplay of genetic factors and stress and lifestyle and so forth. But after the cancer diagnosis, I made quite a few drastic lifestyle changes. I gave up my job with the UN. I moved back home to Namibia, where I live at the moment. I have a more peaceful life. I think I'm getting to a point now where I'm ready now to get back into the career that I used to be in. So I made some career changes, some family changes. My whole family moved here. It was quite a big change for my husband is from Cape Town, for him also to move this side. So those are some of the things that we've changed, some of the big changes that we made.
Thank you, Luzelle. And then just lastly, do you have a word or a message of encouragement to anyone that's currently watching and that is fighting breast cancer at this moment?
I would say, be really patient with yourself, be gentle with yourself. I sometimes got very irritated during the process because people would say, just be positive, just be positive. And the thing is that there's something like toxic positivity. And I believe that you need to be honest and authentic with yourself. Realize that I'm not feeling very positive right now, and this is what I actually need. And go and get what you need. Don't wallow in your negativity or in your depression, but also don't feel the pressure to be strong all the time. There's this notion that people always tell me, you're so courageous, you're so strong, and that is just nonsense, because you're human being. You can't be strong all the time. You can't be courageous all the time. You are just a human being. So know enough about yourself to give yourself what you need, and don't feel the pressure to be this strong person or this courageous person. You are just human. And that is what I would say for them. And never just never give up hope. A lot of people have a lot of things to say because they are ignorant. When you're going through the process, they don't know what to tell you. They don't know what to say to you. And sometimes they just say the most strangest things, but it's just their way of dealing with it. So yeah, just you remain hopeful. That is what I would say to them.
Thank you so much for sharing. I have a question for both you, Ariella and Luzelle. If and this stems from your comment you just made, Luzelle, about people saying the most inappropriate things when they find out or they're insensitive. As a breast cancer survivor, what are the type of words you would love to hear? So for those who are part of the support system can really make sure that they support you the best way possible. What did you wish?
I'm going to own what Lizelle said just now, because I think it's an interesting part of the response, is that every day is a different day. There's a day that I could say something to you and I won't even respond, or you wouldn't respond. And you could say the exact same thing 2 days later, and oh my God, watching a Kleenex advert can have me blubbing on the floor. So there is definitely a heightened sense of emotion, and I'm sure Lizelle will agree with me on that. Stuff that didn't used to phase you now, you drop a bag of potatoes, oh my goodness, it's cataclysmic. It's like, honestly, you think the whole world just collapsed around you. So people can say something that there are days, and you realize people don't know what to say. They don't know what to say. So they're trying to actually be empathetic, and it comes out so badly. And so you can either respond and just now, and unfortunately it sounds terrible, it comes with experience as the years go by, and you just give it the space in the box it warrants. Before you react with a knee-jerk reaction, assume that they did it with a good intention. That is, to me, the mantra. Take it and think, because I actually had someone, and I'll stop talking about this, I had someone who made a comment to me one day, and it was a bad day, and I turned around and I said, were you born that stupid, or did you work hard to get that way? And it was like, I can't believe I just came out with that. I mean, it's kind of funny retrospectively, but but the truth is, I was so shocked that they could say something like so inappropriate. And then I sit back and I think, they probably didn't even filter what they were saying. So I think that would be my comment. Take it from the people, but it gets back to be discerning in who you engage with. It's not a story that you're obligated to tell people. You don't need to fill in the dots for them.
Mm-hmm. Awesome. Thanks for sharing. Luzelle, do you have something you would love to add to that?
I completely agree with Ariella. I think later on in the process, I said to myself, just assume good intent. Assume good intent, because people really don't know how to deal with it at times. And then the other thing, I just wanted sometimes to just be normal, because I got irritated sometimes when people would ask, how are you? But that they're asking, actually, how is it going with the cancer? I wanted to be just Luzelle sometimes. And I wanted to let's just go for coffee. Let's just have a glass of wine. Let's just, do this without cancer always be involved.
Okay. Some wise words being shared. Thank you, ladies. And to those who are tuned into the webinar, if you do have, interactions with a loved one or someone that is currently fighting breast cancer, hopefully this will help you to be more empathetic and also sensitive towards their situation. Ladies, I really appreciate you sharing your journeys. Thank you so much. We now move on to Dr. Wendy Dean Kolom. Good morning. I know it's morning for you right now.
Yes, it's about 6:30 in the U.S. in the morning, but thank you. Good morning, everyone.
Good morning, very early. What time do you normally wake up in the mornings?
I usually wake up at 6:30, but this morning I got up at 5 to kind of put on a face for you all
We
this morning.
appreciate you breaking the routine for us. Thank you. Dr. Wendy, you heard the stories that Luzelle and Ariella shared. Can you quickly highlight for us what types of breast cancer there are for some of our viewers that do not know?
Right. So actually, one of the big things that we do on all invasive breast cancers, and even the non-invasive one, is we do molecular testing, and that looks at certain markers called ER, PR, and HER2. Now, ER stands for estrogen receptor, PR stands for progesterone receptor, and those two, either one can be positive. That means you have hormone receptor positive breast cancer. And the other one is HER2, and HER2 is a growth factor, and it can be positive alone, or it can be positive with any one of the hormone receptor positive. If all three, ER, PR, and HER2 is positive, it's considered triple positive. If all three are negative, it's considered triple negative. And if one of the ER, PR is positive, it's hormone receptor. And those three designation is what drives how we treat breast cancers, but also has prognostic information. So when people talk about your 5-year overall survival, it also is based upon what group you fall into. So we think about it as being technically 3 major groups, but it could really be 4 if you take the triple positive out from the hormone receptor positive. And that's important for women to know, because a lot of times I'll get new patients who will come in and I will ask them, what stage was your cancer? And like Ariella said, she knew her stage, or there was a question about her stage. That's very important, because that has some prediction for outcomes, but also the type you have is important. So women, if you are diagnosed, you need to make sure you get a full understanding of your staging and also the type of breast cancer.
Thank you. Dr. Wendy, I just wanted to know, when Luzelle shared her initial story where she was misdiagnosed, or they assumed it was something else, what can a patient do in a situation like that?
So my specialty is breast cancer, and I trained at MD Anderson, and I tell all postmenopausal women, if you feel a lump, do not let a doctor tell you, oh, we're going to wait a month to see what happens. If you are a postmenopausal woman or a woman above the age of 50, no, you tell them, I want to get an ultrasound and I want to get a biopsy of the lung. Do not let them tell you. They can say, oh, it looks benign, or it doesn't look like cancer, but you don't know until you do the biopsy. As Ariella said earlier, you need the biopsy to confirm that it's cancer. So if you don't get that done, sometimes radiologists, they're human. They make mistakes. So unless you have that biopsy, you really don't know. So if you're a younger woman and you're cycling and you feel a lump, then it's very often that it's just a fibrocystic change from your cycles. But a postmenopausal woman or an older woman should not let anyone tell them, oh, we're just going to wait and see, or it doesn't look. You make sure you let them know, I want it biopsy. You have to speak up for yourself, because a lot of times people with different experience and training, can make a mistake. So you want to know for sure, because that can totally impact the rest of your life.
Thank you for that. And then what are some of the biggest misconceptions about breast cancer? I mean, how many patients are actually diagnosed with breast cancer due to unhealthy lifestyles?
So we are learning more and more about cancers that are preventable, or cancers that we can reduce the risk based upon lifestyle modifications. With breast cancer, so I know in South Africa, I've done medical missions in South Africa. I've done conferences on breast cancer and clinical trials in South Africa. I was just there last year in September at the University of Cape Town with Dr. Denny and their group. So I can tell you that we now know, and part of our guidelines and our instructions to patient after they finished their cancer treatment is we're making recommendations now about how do you get the optimal outcome from your breast cancer diagnosis. And one of the things we used to tell women and other people, oh, you could drink 2 glasses of wine a day and you're okay. Well, now we know that 2 glasses of wine a day, or in total, 7 or more glasses of alcoholic beverage a week increases your risk of breast cancer. So in that regard, you need to make sure that you're drinking less than 7 alcoholic beverages a week. We also now know that postmenopausal women who are overweight have a worse survival from their breast cancer just because they're overweight. Because a lot of women don't realize that when you become postmenopausal, your ovaries are not making hormones, but your fat cells are making hormones. So a lot of times the pills that we're giving you are not enough to counterbalance the fact that you're making extra hormones in your fat cells. So that's new information we're learning. So then I have to tell them, you need to lose weight, increase your physical activity, watch your diet, try to eat a well-balanced diet rich in fruits and vegetables. So now we know those things are making a difference. And we think that on average, probably 10 to 15% of cancer reoccurrence can be related to that. And because we know that obesity now is being really targeted and investigated as increasing your risk of breast cancer for initial diagnosis, that is still being studied. But I anticipate that over time, we're going to get some of those findings as well. We do know that in women of African descent, obesity seems to make a difference in increasing their risk of development of breast cancer. So I think more of that will be coming out. But definitely, as these great women have said who've been diagnosed with breast cancer, making those lifestyle changes is going to be very important for them to get the optimal outcome from their diagnosis.
Fantastic. So living a healthy lifestyle, if you're not currently living one, making some adjustments to make sure that you are. And I know that technology is evolving. I mean, look at us having a webinar all over the world. I mean, Luzelle is sitting in Namibia, you are in the US. In terms of when it comes to breast cancer treatments, have they brought out anything new?
Yes, actually, we are making great advances. We're getting new drugs being approved every year. One of the areas that is of big concern is triple negative breast cancer. And triple negative breast cancer, as I said earlier, has the ER, PR, and HER2. It is considered an unmet need because we've had a problem with trying to find targeted treatments. So if you have an early stage hormone receptor positive, you may do your surgery, maybe some radiation or not, and then you can take a pill for 5 to 10 years. If you have HER2 positive breast cancer, they can give you a monoclonal antibody with your chemotherapy to help you with your breast cancer to decrease the risk of recurrence. With triple negative breast cancer, the only treatment we have is chemotherapy. And unfortunately, even women who get that chemotherapy up front, a large percentage of them will have a reoccurrence, and it's usually metastatic disease. So now it's incurable. And we didn't have a lot of great treatment options. So just with that, we now see that immunotherapy, some of the immunotherapy that you're seeing being used in lung cancer and other diseases has begun to make an impact on treatment of women with triple negative breast cancer. We see that in the last couple of years, we've had 2 new hormone blocker treatments for women with hormone positive breast cancer. And we're now beginning to get some other treatments for HER2 positive breast cancer. And we're now learning the benefit also of giving chemotherapy up front, what we call neoadjuvant chemotherapy for some of these aggressive cancers so that we can decrease the risk of recurrence. And not only with the treatment side of it, but as Ariella said before, now we have some more diagnostic tools that help us know who really needs chemotherapy. Because in the past, we treated everybody the same. But now you can do the Oncotype DX or the MammaPrint. And those tests look at certain genes in your cancer to determine would you benefit from chemotherapy or would you not benefit from chemotherapy? So technology has really been advancing. We need people participating in clinical trials because that's how we get that information to then fine tune the treatment we have and expose women to less of these toxic treatments.
Okay, very informative. And it's nice to know that, things are developing at a rapid rate by the sounds of things. Dr. Wendy, I have a statistic here in front of me and I need your input on this. Is it true that 70% of mastectomies aren't necessary, and why are women still undergoing this treatment if this is true?
So I've kind of looked at that information, and I will say that it's probably true when maybe you're looking at all women involved. That is not going to be the case for certain high-risk populations. So that general statistics is applied across women, but if we break it down, there are some women who are at high risk of developing breast cancer or having a recurrence of breast cancer who may benefit. Those are women who have the genetic mutations, BRCA1 and BRCA2, or other mutations that we're now seeing can increase your risk. The other thing is women who have a family history, a strong family history of breast cancer, and who have been diagnosed with breast cancer. So if I have a woman who is BRCA1 or 2 positive, then I do recommend, or at least offer them the option of bilateral mastectomies, even before they get breast cancer. If a woman develops breast cancer and she has those mutations, then we recommend that. Also, a woman who has breast cancer and has a strong family history, then that may be an option, especially women who are less than the age of 50 in her family, or she's less than the age of 50 when she's diagnosed. So that you will find that where you are located and where you get your treatment is going to be a large determinant of what the surgeon recommends. So if you're in big academic institutions that are trying to practice standard of care, then most of them are moving away from these mastectomies and understanding that that does not improve the survival of women. So you're having them undergo a surgery that can really impact their view of themselves and how they perceive themselves as women, that is not necessary to improve their survival. So I think those are the questions that women really need to ask. How would this improve my survival? Because a lot of times they're doing things from the old days when they used to do these mastectomies, especially if you have older surgeons sometimes, and people are not keeping up with the literature and with the knowledge that we've gained. But yes, a lot of women, even now, I see it in the US, a lot of women are recommended to have bilateral mastectomies, and they come to see me for their oncology care after seeing the surgeon. And the question is, why did he recommend that? And I go through the statistics, I go through the data, and a large part of it is their comfort. And I think we have to be cognizant of how that woman feels about themselves. But if that woman wants to save her breast, then, and she meets the criteria, that should be the first option that she gets. But unfortunately, it doesn't happen that way. And that's why these things are so important, these webinars, because we need to educate women to advocate for themselves, as the other two survivors said earlier.
And I think, you know what, you hit the nail on the head. And I feel like we need to bring Cara Noble into this conversation. She's National Relationship Manager at Cancer. And I think it could be an interesting way to just look at how South Africa's treatment is currently going versus the US, because Dr. Wendy, that's where you are based at the moment. Cara, hello officially.
Hi, thank you for having me.
I feel like, can we briefly just discuss in terms of healthcare and treatments available to South Africans at the moment? And then perhaps, Dr. Wendy, you can weigh in and just give us an idea of what's happening in the US at the moment.
Okay, so if I can go from I think the biggest challenge for us is obviously then having our public and private divide. I think if I look at what is available in a lot of private sectors in South Africa, those patients that are blessed enough to have medical aid, they are getting world-class care. We know that our oncologists and doctors and medical professionals in South Africa are really top class. The treatments they are bringing, we know a lot of international partnerships with various universities, etc. The access those patients have to more groundbreaking opportunities is really incredible. Unfortunately, the challenge in the state sector, it is very, very different. And I think with the challenge, for example, like Aurelia said, she had 5 days. She went and saw someone maybe a week and a half, and she's got a plan and she's going for it. Do you know what I mean? She's getting sorted out, and that's what it is. Unfortunately, in the state sector, it's not as simple because there are a lot more challenges. For example, and I want to just clearly state, the Cancer Association works with private and public sector oncology departments, and I can tell you that they are the most incredible oncologists and nurses. Well, making me thirsty, Amelia. Water. But we also have the most amazing oncologists in our public sector as well. They just have a lot less resources to work with than those in the private sector. For an example, an average oncologist might see 30 patients like within a day. It's almost like, and their whole goal is to literally, are you fine? Where's your card? What did tests say? Let's get you on treatment. Let's go. Next guy. Let's go. Next guy. Let's go. And the purpose is trying to literally save lives, getting people onto that treatment schedule. Because, for example, like now, we have women that are presenting with symptoms that are waiting 4 to 6 months for a mammogram in some areas. And that's just that. And then the same thing will happen with treatment, where, for example, now, okay, finally, biopsies come through, you've been diagnosed, we know now, and your treatment waits sometimes 3, sometimes 9 months. COVID has really been bad in terms of, there have been some challenges where certain cancers have had difficulty with drug access, etc. And it's been difficult. Some patients are getting diagnosed now and have appointments in February, March. But again, it's not a lack of the passion and the care of the oncologists and actually the most fantastic nurses. It's just the amount of people that need care and the amount of professionals that are there available to care for them is actually what our biggest challenge is. The doctor per capita and nurse per capita is just insane. With the amount of new cancer cases that are coming across, and especially with breast cancer being the number one amongst South African women, it definitely does put a challenge. I think these are challenges of being like a third world, and because, that stat that goes around, I saw it again yesterday in the news where it says we are one of the most unequal societies. I think we are the most unequal society in the whole world. That's the stat they said in the news. And it's crazy because we do have some people like our ladies here that actually could receive like world class, but then a lot of majority of South Africans do not have access to that and are really struggling, that they can't even get transport to even get to their treatment. And with poverty and also a very important thing people don't realize is that when you have access to, it's called Maslow's hierarchy of needs, and it just explains like what does a basic person need to function. And you need like clothes, you need shelter, you need food, you need love. And if you can just have those 5 things, you can actually, like everything else is an extra, but the basic human can function if they just have those basic things. And a lot of people and a lot of patients are poor and very bad poverty. They can't even afford to get their treatment. They have a lot of challenges that they're facing. So, and you can imagine now someone's on hectic chemotherapy, radiation, whatever treatment is available, and they're not eating properly. They're having maize meal for breakfast. So, you know what I mean? Like having a good diet. And it's also again what they are mentioning about those lifestyle changes and taking care of your body. A lot of our people don't have those luxuries. And I think that is the biggest challenge that's facing the South African oncology is the fact that a lot of our patients can't take care of themselves properly. When you're adding on the burden of cancer, we are getting poorer treatment outcomes.
Okay. Well, Cara, thank you so much for shedding light on what the I don't want to say the situation, but the status is here in South Africa from cancer's perspective. Dr. Dean Kolong, do you mind telling us, because you've been to South Africa and you obviously live in the US, do you have some comparisons that you can draw, some differences you're willing to point out?
Yes. So when I first went to South Africa, it was in 2012. I went as part of a medical mission started from a lady that worked at MD Anderson when I was doing my training. And we went to Durban. And luckily during that visit, we had an opportunity to go to a cancer facility where patients who needed treatment were able to go and be closer to their treatment because they lived so far away. So it was one of the most amazing experiences, because even though we have the American Cancer Society here, it was just so revealing and refreshing to see cancer working in South Africa. So Cara, I really appreciate the work that you do. But she's right, the challenges that those patients face is really very sad. And one of the things I think we would be remiss if we don't talk about in this climate, the disparity. Cancer disparity, which means people of certain ethnic or socioeconomic status have worse outcome. They die more frequently often because of ethnicity or social status, because of lack of access to care. And when you think about South Africa, although it, is considered Africa, and some people may say third world, it truly is not. When you look at the overall healthcare infrastructure there, they have the ability to do a lot. It's just only certain people have access to that. And unfortunately, that is the same thing that exists here in the U.S. I often see in the U.S. things that I see when I do medical missions to Nigeria, with people who are poor not getting access to care. So I think as a group, as women, I think about things as being my sister's keeper. So as I get knowledge, I want my sister to get that knowledge. And as I can, improve my status and get access to care, I want to be involved in programs like cancer and other places that will provide housing and transportation needs and other things, and even their ability to get to positions. So I think it has to be a movement where we see each other's as our sister's keeper, and we're going to be the movers and shakers of trying to get the word out that this is unacceptable when we are such a resource-rich country. That's what I'm doing in the U.S. and a lot of other people, and that's what I see you all doing, and part of what you're doing, being a part of this webinar. But we need to be more active. Women are so powerful. In the U.S., one of the things that we were able to do is that every single state in the United States has a breast and cervical cancer early detection program, where women who are underserved or underprivileged have access to get free mammograms and cervical cancer screening. And that came about because of women going to the legislature, sitting on the steps, hounding their legislatures to say every state should have that poor women at least has access to get the screening. People still have challenges if they live in poor areas. But that's a part of it. But at least every state has that program now. So I think as we come together as women, we can begin to try to elevate it, but we can't stop. There's so much work to be done. We have to keep pushing forward.
So much.
Thank you for highlighting that.
Sorry, Zoe, can I just say that I think you came to my office in Durban. It is a care center. We've been there since 1975, and we have 12 of those facilities around the country, assisting patients to have access to treatment. So I'm so glad you got to experience that. They are, it's really the core work of what we do as cancer. So I'm so glad you actually came through. That's amazing.
Well, cancer definitely plays a very big role here in South Africa. And I know it is close to the end of Breast Cancer Awareness Month. Cara, can you shed some light on why it is so important for us to celebrate this month?
I think we just need to get women talking. I think it's just like Wendy said, and I think it's like when one woman's gone to the gynae or had like, oh, I don't know what, I have my pap smear, or had like, oh, my gynae checked my breast. You're like, oh, and then you find something, or the gynae told you something. Tell your friends at tea. Like, I think this is about talking about it, spreading the message, because this is always the challenge we find, is that women are not doing monthly breast examinations. And this is the biggest challenge we have as an organization, because they are waiting for the opportunity for a mammogram. They think that they can go through 2 years, ignore their breast, not look at it, not even smile at it, and then in 2 years, the auntie's going to scan you and it'll be all fine. But it doesn't work like that. You actually need to know your body. And we always say, there's no disrespect to the doctors, but when you walk in, you say, hey, this is not right. I'm feeling this. You know your body so well that you're able to communicate with the doctor to advise them so they can then figure out what is wrong with you. But if you aren't aware of your breast and what's going on there, then you actually are at a disadvantage. And everyone always says, we have so many conundrums. Oh, there's no breast cancer in my family, like Aurelia said. Oh, so I would need to do self-breast examinations monthly. And then what Lizelle said, having Dr. Jean in her family, so for example, we would say that if you have a mother, a sister, an auntie, someone in your direct line that has breast cancer from as young as the age of 24, we would recommend you to start being a lot more aware of your body and examining your breast. And I think, as Dr. Wendy also said about, with your period time, Obviously your whole body's going, there's a perfect African word for that, demakar, because that's exactly what your body's happening. It means confused, but you're literally all over the place and trying not to kill people that you love when you have the period. So, you would always say you wait a week afterwards, and then you would actually do your monthly breast exam. And it's so important because you need to take ownership of your body. And so, yeah, this is why we have to get talking and encouraging women to actually take control of their bodies. And we always say, and people say, oh, but how do I know if I should? We say, do you have a boob? Yes. Okay, great. That means you also must do your own breast examination. That's how simple it is. There's no easy way out for any lady to not do a monthly breast examination a week after her period. Please.
Okay. Well, Cara, thank you for sharing that. I know that, cancer, you guys rely heavily on donations. And when donations do come in, do you mind telling us how people can support you and what do you do with those donations that come in?
So I think I'm just so glad that Wendy brought it up and that she had a first-hand experience, because I think a few, cancer's been around for 89 years. So next year is our 90th birthday, if you can believe that. So that's just a long time to be around, and we do such a variety of services. It's probably actually too much to actually explain to people. But I think that one of the smallest things in a nutshell that we could say is that we are there to support patients through their journey of cancer. And I think that is one of the core focuses that we do as a business, as you could say. And we have a variety of things. As you can see here, this is a picture of one of our care homes. You get taken to and from treatment centers, your 3 meals a day. The emotional support is also extremely important. It is being part of a support group. It's having counseling. And we also passionately believe that patients will cope better if their loved ones, caregivers, that could be husband, neighbor, family member, sister, aunt, our families and life is very mixed. If they also feel supported, you can not only focus on uplifting and supporting the cancer patient. It is so important. I think like Lizelle said, it was hard on her kids, The whole family takes a knock when someone has cancer. And those people that are driving that person to treatment or being there and cleaning up the vomit or holding you when you can't get out of bed just to go to the bathroom, those people need support. And that's a big gap. And as a social worker myself, we really want to focus on that. And so when we offer, for example, we offer Aurelia counseling, we would offer her husband, her sister, her mother, anyone else that needed counseling too, because we know the family copes better. And cancer does those support things through quite a few options. You showed now recently our telecounseling service. And through COVID, it was really difficult on our patients. In South Africa, Cancer Association was an essential service, which means they kept our care homes open throughout lockdown. We didn't even stop for a minute because oncology never stopped actually anywhere in the country. There was not one oncology center that stopped during lockdown. So cancer patients were under an immense amount of pressure and under such strict instructions from the oncologist to say, listen, you have a high risk of contracting COVID. You have to go to treatment at home. Don't do anything. You literally have to be more crazy than the rest of us trying to be crazy and COVID ready and respecting the protocols. So they really went through a lot. And our telephonic counseling service has really been able to help us reach people because cancer patients are not coming to our offices. They are not attending support groups still. They are really limited. So that means we can reach you in 7 different languages. It's in English, Afrikaans, isiXhosa, isiZulu, Siswati, and Sesotho. And we'll call you back at our cost. So there's no charge for you. We can call you in the comfort of your own home, and we can also help your family members. So that's our core focus. We want to help you cope through your illness, and you don't have to be alone. You really don't, but you have to reach out. There's a lot of client confidentiality. You can speak to anyone here. I think, for example, I wouldn't like to get Aurelia on a bad day and say, hi, I got your number from your oncologist, and he said you might need some help today. How are you feeling? It's not going to go down very well. So it's always the patient's choice. If the patient needs us, we are here for you. You can even call us on our talking number, 0800 22 6622. But if you need us, call us and we'll try our best to support you.
See, this is why webinars are so important and having these discussions, because now people know that there is help available to them. There is access to information and treatments. And you know what, when it comes to the S-Connect group, they are a wonderful organization. And I want to ask you, Cara, how has S-Connect Women, assisted cancer, and how can people support you guys?
Well, I think we're just so blessed. I'm actually privileged to have known Meg for actually quite a few years because our husbands used to play rugby together. So when she called me up, so Norm used to be in the box together, and it's been a few years, and she was like, "I see you're still crazy enough to be working for an NGO, and I've been just seeing what the wonderful work you guys have been doing, and like we just want to get involved with you." And I was like, "Oh my gosh." This is the most incredible answer to prayer because it's been very difficult, not only for cancer, but for all NGOs, I think with the, having a 3 million unemployment rate now in South Africa, it's absolutely chronic. We're in such difficult times. So companies are not prioritizing their CSR budget, which is their community social investment. They're not prioritizing extras. They're not, you know what I mean? People are just trying to keep their staff and then trying to carry on and try and keep their business going. So when it comes to having a choice, like, should we help a charity or not? It's just, from already being difficult the past 2 years, it's literally zero priority. So we are so incredibly grateful because unfortunately patients need us and they need our social workers and our nurses and they need our counseling. But at the same time, though, if we're not getting those donations in, if it is like a straight donation or from a function or something like that, then it's a struggle for us. We're not able to keep on doing the services if we don't have income coming in to help actually fund them. So yeah, it's been a very challenging time for us as an organization, but we're just so grateful to S Group for just for their compassion and for still wanting to get involved in charitable work even despite these really difficult and contentious times, not only in South Africa but around the world. So yeah, thank you so much and for this opportunity to share and be here today. And yeah, we are so grateful.
Well, thank you so much. I really just want to thank each and every one of you for taking time out of your day. I know, Dr. Wendy, it's very early for you right now, but I just wanted to say thank you so much to everyone that also tuned into this webinar. It's really important that we support one another and create this hub. And like Dr. Wendy mentioned earlier, that it's so important to also have these webinars. Now, if I just want to ask each and every one of you, if you have a closing statement that you would love to give. Should I put someone on the spot?
I'm going to go first. Okay, go for it.
So you go for it. You can go.
Okay, mine's going to be brief. Our biggest lesson is make peace with what is thrown at you. Don't blame doctors. They're human. They make errors. They are trying their best. 9 out of 10 times they have the best intentions, but you need to own your journey. And that for me is honestly the most important part.
Thank you, Ariella. Powerful. Dr. Wendy?
So again, I want to kind of remind each other to be each other's, our sister's keeper in our community, at work, at church, at synagogue. It's so important. And I also want to remind people that oftentimes when a person like our two, Zell and Ariella, when they got diagnosed, sometimes we just don't know what to say. But I often tell people, you can help in so many ways. Sometimes it's you offering to go with them to their appointment, not getting in their business, going into the doctor's office. You can say, I'm going to be here with you. I'm going to sit in the lobby until you're ready. And then after you're finished, we're going to go get some lunch. Sometimes it could be as simple as saying, you know what, I cooked a meal and I'm just dropping it off for you all. Sometimes it could be that woman needs some rest, as Luzelle said, when she's going through treatment. Somebody takes her kids to the movies with their children. It's simple things. It's not just saying, oh, call me if you need anything, because a lot of people won't call you because they don't want to get burdened. So we have to be more proactive to support them by doing those things, not just offering, but being active in providing our help to them.
Thank you so much. Luzelle, do you have anything you would love to add?
Well, I really enjoyed listening to everyone speaking. I took a lot of notes, so thank you to all the panel members. What I'm thinking is just a lot of women write to me. Sometimes I share my story on Facebook or on other platforms, and especially young women struggle with life after breast cancer. And what I would say to women like that, if you've had a mastectomy, for example, some women haven't had reconstruction and they really struggle with it. They struggle with depression. They don't see themselves the way they used to be. There's issues of infertility. There's so many different issues that you deal with after breast cancer diagnosis as a young woman. And I would say to those women that they should just never give up hope. They should just never give up, and know that there's life after breast cancer, and prioritize your emotional, your psychological, your mental health as well, because this thing is it really takes a toll on you, not just physically, but it takes a toll on you emotionally and psychologically as well. So I would encourage women to really look after their mental and their emotional health, and to prioritize that, and not to be ashamed of it, because there's a lot of stigma around mental health as well. And just prioritize that as well.
Thank you so much, Lucelle. Really appreciate that. And Cara, from a personal or cancer perspective, is there a closing statement you would love to give?
I would like to say, be kind. You might not understand what that person is going through, and please be sensitive about staging. This is probably my biggest frustration, is when people reveal, oh, I've got stage 3 breast cancer. It's like, oh, really? But you don't look sick. Or I think it's the interrogation. Please stop interrogating cancer patients. Breast cancer patients, just stop interrogating them. When you ask how they are, ask with a kind heart, not because you need to know the information and you want to understand their staging for your entertainment. So please be kind. You don't realize how sometimes that can really, really hurt. So please be kind, and also check into your loved ones, to the caregivers. Make sure those guys are also holding it together so that the breast cancer patient gets all the love and support they need. And I agree with Dr. Wendy. Commit, just offer something and do it, and it'll be such a blessing to that family. Thank you so much.
Thank you, ladies. This has been so informative and wonderful. Thank you for offering up your time. And I'm pretty sure, I know we all have been making notes. So thank you so much for this wonderful session. I just wanted to say thank you once again, and have a wonderful day. And to our South African viewers, make sure you check out Cancer. Your website is cancer.org.za. You guys have all of the contact information and details. And also, if you would love to make a donation or contribute in any way, all of those details can be found on Cancer's website. Well, that's it from me. Thank you.
Thanks very much, guys. Take care. Stay healthy.
Bye.
Cheers.
Thank you.
Bye.
Thank you, Zoe. Bye. Bye, everyone.
Bye.